All right, thank you very much for your introduction. So I'm from the University Medical Center in Utrecht, and I will present today our study where we looked into predicting factors for urethroplasty failure. So as we know, urethroplasty is one of the most successful treatment options for urethral strictures in men, but strictures do recur even after urethroplasty. So what we tried to do with our study was to identify a patient population being more likely to suffer stricture recurrence after surgery. We reviewed 250 medical files of patients who underwent surgery between 2011 and 2018. And what was so unique about this population was that they were all followed in a very standardized manner, as you see depicted below. So we collected data on patient characteristics, stricture characteristics, and surgical technique, and our endpoint was defined stricture recurrence as the need for any post-operative instrumentation. So this also includes outpatient dilatation, for example. In the end, 175 patients were eligible for inclusion, and our success rate was above 80%. So these are the results where we show success and failure in the specific patient groups. And as you can see, surgical techniques using dorsal grafts have significantly higher success rates, as well as strictures which have an idiopathic etiology. But on the other hand, we did also see when a combination of surgical techniques were used on strictures on more than one location in the urethra, failure rates were much higher. And we did also see a significantly higher failure rate in iatrogenic strictures and pelvic fractures. So what this study taught us is that it's important to consider the impact of these aforementioned surgical and patient characteristics on the success rate of your surgery. And we'd recommend to preoperatively consider these characteristics before you plan surgery, counsel patients accordingly, and perhaps even follow certain patients more closely during follow-up. Thank you very much.
Open for questions from the floor. Again, in your practice now, to which extent specifically this influenced your decision in consultation with an individual patient? Is this just based on some of this so-called objective criteria? And is this then a black and white decision? Means if there is one or two factors, will you go for yes, urethroplasty or not?
I think it's never a black and white decision. It's all part of a larger decision-making plan in which these factors can play a role in, well, the end. Maybe, for example, if you have a patient who is on the beginning less eligible for surgery, then these factors can, well, be an extra part in deciding another treatment option, for example.
Seeing so much in the results of the work you've been doing, could the conclusion be that there is more to say in favor of urethroplasty rather than prolonged other forms of manipulation or urethral treatment? Did it ameliorate your look on urethroplasty or rather make it having a more negative look?
I think, well, we didn't compare urethroplasty to other less invasive treatment options, but I think a success rate of 80% is quite acceptable for a surgery, yeah.
Mm-hmm. Any other comments? If not, we thank you for your presentation.
Thank you very much.